Hi everybody, it's Kate from Valere, and today I'm going to talk to you about medial tibial stress syndrome, or more commonly known as shin splints, and how you know if you have shin splints or whether you may have something else. Please keep in mind that this does not replace medical advice. If you do have a form of shin pain and you want an official diagnosis, make sure that you see the appropriate healthcare professional. But I do want to give you some tips that can hopefully lead you down the right direction so you can return to running or improve your performance as much as you can. Typically, shin splints are exacerbated by any activity that involves that jumping and landing or the impact with the ground, so typically running. Now, if this does reproduce your symptoms and your pain is greater than 5 centimeters along the tibia, that could be a sign that you do have shin splints. So I'm going to show you what that means. So if we come down and we have a look at our tibia, so I'm going to pull this up so you can see, okay? Our tibia is our shin bone, which is commonly why medial tibial stress syndrome is called shin splints. So if we palpate along here, now our shin splints are on what's called the posterior medial border. So what that means is sort of the back or the posterior of that shin bone on the inside. So the medial bit here, not on the outside. So on this medial bit, if you were to palpate along here, and you can stick your fingers in, that depends, how sore you are, of course. But if you were palpating along here, typically with shin splints, the area that is sore should be about 5 centimeters at a minimum or greater, more commonly known as the distal third or sometimes even 2/3 of the tibia. Now, if you are palpating along here and it's at 5 centimeters or greater, that is a sign that you do have shin splints. But if you were palpating along here and you're going with one finger and you're palpating along and there is particular reproduction of your pain and it's pinpoint, so that means just with one finger that you can really feel your pain and it's just in that area. Other areas around it may be a little bit tender, but if you can really reproduce it just with one finger, that could be a sign that you could have a bony stress injury such as a stress reaction or a stress fracture. So if you do have that pinpoint pain, I would suggest considering if it's worth getting cleared that you do have a stress fracture. Some other considerations that you may want to keep in mind whether you have shin splints or a stress fracture is night pain. Sometimes shin splints can hurt a little bit at night, particularly if you've gone for a run in that afternoon. But if you have that pinpoint pain that is waking you at nighttime and it's really sore at nighttime, that's definitely a flag that you should get cleared for a stress fracture. Other things are with that pain getting really, really exacerbated during running, particularly on that stance phase of running. If that's getting very, very sore, more than a 5 or 6 out of 10, definitely consider getting cleared for a stress fracture. Something else that you want to differentially diagnose, so that means the other alternative to being medial tibial stress syndrome or shin splints, is something called chronic exertional compartment syndrome. Whilst running in particular can flare up shin splints, if you are noticing when you go for a run, you're getting an immediate exacerbation of your symptoms, and that is getting a lot worse during your run. But then when you stop, it ceases or it goes away quite quickly, so being after a minute or two, then you might want to get cleared for chronic exertional compartment syndrome. So that's an increase in your pressure in that front anterior compartment of your shin. Some other things that you may want to consider when it comes to differentiating whether you have shin splints or chronic exertional compartment syndrome are, is there any swelling in the area? Can you visibly see any swelling? Is there any numbness, any pins and needles, or any tingling, particularly in your shin, but also in your foot as well? These can be clear signs that you may actually have that chronic exertional compartment syndrome. So if you do have any of those symptoms, they are not characteristic of shin splints. You shouldn't have those with shin splints. So if you do, make sure you seek medical help as soon as you conveniently can to make sure you don't have compartment syndrome. In a nutshell, shin splints are made worse with running. That pain, though, should be greater than or equal to that 5 centimeters along that tibia. If it's less than that, consider clearing for a stress fracture. Shin splints do not display as any form of swelling, numbness, tingling, or any form of altered sensation around that shin. If you have that, make sure you clear that chronic exertional compartment syndrome. I hope that you found these tips helpful. If it does sound like you have shin splints, make sure you check out this video where we go through our most helpful tips to help you get back to running as soon as you can.